Maternal health is a cause for concern, especially in developing countries like Nigeria. Highlighting salient aspects of this branch of medicine is a step in the right direction in challenging critical stakeholders into taking necessary steps towards addressing them. A mini documentary will give you an insight into the topic on our radar today. Endometriosis. This will come up immediately after this short break. My name is Yetunde Jayola. Please stay tuned.
There's a pervading silence on endometriosis, which is a common yet scarcely talked about condition in our society. Experts and researchers have documented that a vast majority of women under the age of 25 experience menstrual pain. Even if this pain is severe, it is often dismissed as a normal and natural part of being a woman. However, experts have concluded that dysmenorrhea or painful menstrual experience may be a symptom of menstrual disorders such as endometriosis. According to the United States of America's Center for Disease Control, CDC, in a 2022 report, endometriosis affects 1 in 10 women worldwide and is therefore as common as diabetes.
To drop some notions which the society...
Sadly, the average delay between the onset of the first symptom and the final diagnosis of endometriosis is 7 years. Experts posit that one of the primary drivers of the significant delay experienced is menstrual stigma. Talking about period pain or other menstrual symptoms is still considered socially unacceptable. Therefore, there is a need for public awareness and a holistic health intervention aimed at the reduction of menstrual stigma to promote women's health and well-being. Thus, interventions are needed that 1. Correct the social norms surrounding menstruation. 2. Follow a holistic approach, recognizing the importance of educating not only women but also men about menstrual disorders. Bridging the knowledge gap plays a pivotal role in reducing stigma. Educational interventions on endometriosis help in correcting the perceived social norms towards menstruation, thereby going a long way to reduce menstrual stigma and lead to greater acceptance of policy measures aiming to protect menstruating women. The development of effective evidence-based campaigns will contribute to breaking the menstrual-related communication taboo that negatively impacts women worldwide.
According to our resource person, Dr. Sekina Raji, menstrual cramp is not a normal condition. This I am coming across for the very first time. We will get to learn more from her, but first, let's hear the views of Nigerians on matters and symptoms related to endometriosis. Thereafter, the specialists in the house will explain in details important issues arising from the respondents. and symptoms arising. Symptoms arising. Symptoms arising. Symptoms arising.
Ideally, it's not meant to be too painful because it's a normal physiological process. When a girl is growing up, the girl will prepare her mind that at a certain age, she will begin to experience menstruation, and menstruation could come with pain. So that psychological preparation may make the patient or the student or the young girl to cope better. When ladies know that they need to go for checkup to address certain disease conditions, of course, if those conditions that may aggravate most severe painful menstruation are handled, of course, the menstruation period will be less painful. The other thing is choice of food. There are certain kind of foods they could eat during that period that will also reduce the impact of the pain. The other one is the medications. There are some that know the kind of medication they take during menstruation. So once the menstruation sets in, they will just get the drug. They take it 2-3 days, and they cope better with it.
I have actually met with a lot of female, myself included. We experience that kind of pain during our menstrual period. It is called dysmenorrhea or menstrual cramps, and it's actually a very painful experience. There was a period I was supposed to go for a program. Lo and behold, I got my period and I couldn't stand it. I could not even stand up. I was having back pain from my waist to my legs. It was so painful that I couldn't go to work. And my boss, as a very kind person that he is, I called him and he said I should take the day off. And the second day, so that was how I dealt with it. I went to the hospital, I took drugs, and I had bed rest for the full day. We have different pain threshold. Some of us can withstand a lot of pain, and some they react with the little pain. Then when menstrual pain is becoming too much, it is advisable to see the medical personnel because it could be another disease condition masquerading as a menstrual cramp. And if it is too painful and it is not relieved with at least paracetamol, it is advisable to visit the medical personnel.
In the words of Pablo Picasso, action is the foundational key to all success. Steps to taking action to reverse the scourge of endometriosis are well articulated in the next segment by Dr. Sekina Raji, a consultant obstetrician and gynecologist at the National Hospital, Abuja. Thank you for keeping faith with the program.
Endometriosis is the presence of endometrial tissue or endometrium-like tissue in a place other than the lining of the uterus. The endometrium is the lining of the uterus. It's that part of the uterus that a woman sheds most of it when she's menstruating. And it's also the part of the uterus, if a woman gets pregnant, where the embryo implants inside the uterus. So endometriosis is the presence of this tissue or something like it in places other than lining the uterus. That it can be present in the brain, in the lungs, along the peritoneal wall, that is the lining of the abdomen, in the pelvis of a woman, and it can cause a lot of havoc. What it usually causes is that it causes inflammation, chronic inflammation, and this will lead to formation of scar tissue. Scar tissue, we call it fibrosis, adhesions. When this inflammation occurs, it allows the organs in the pelvis or in the abdomen to be stuck together, causing adhesions. Organs are supposed to be moving over themselves. They are now stuck in one place. So this now leads to pain, most of the time, pain in these women. Many of these women experience pain before their menses, during their menses, because it's dependent on a hormone we call estrogen, which allows it to grow. So usually when estrogen is at its peak, usually maybe around ovulation or before a woman menstruates. So many women have menstrual pain and they feel it is normal. Menstrual pain is not a natural process of the reproductive life of a woman. A woman is supposed to have a painless menstruation, but many people have taken menstrual pain as a normal thing. And some people's menstrual pain is so severe that it prevents them from doing their normal activities. Many of them don't come to work, which can affect the income of the country. So there's a lot of effect of endometriosis that many people do not know. As a matter of fact, it occurs in 10%, that's up to 190 million of women in the reproductive age group. And most women that suffer from chronic pelvic pain in Nigeria, up to 48% of these are caused by endometriosis. And even some women have it and they don't even know they have it. That is, they are asymptomatic. And this also occurs in almost 50% of women in our country. Endometriosis is actually a disease of women of reproductive age group, which is usually between the age of 15 to 49 years, according to WHO. So, any woman that experiences severe pain or disturbing pain before, during, or even after her menses, especially in her lower abdominal area, she should, present to the hospital for investigation. And also, women that have all these pain symptoms elsewhere, because some patients present with coughing blood or around their menstrual periods. Some people present with painful stooling around their menstrual period or even painful urination. So because it's a disease of the pelvic organs that can ascend, and early detection is key. Once some of these symptoms are seen, a woman should present to the hospital so that she can be investigated, because it's something that the investigation is not just clear cut like that. Some investigations that can be done in the hospital include maybe like ultrasound, and sometimes they might see it, sometimes they might not see it. They only see it when it has formed a cyst. But many of the time, naked eye cannot see endometriosis. So what actually diagnoses endometriosis is by doing a procedure called laparoscopy. And laparoscopy, which is a field of gynecology that I am into, it's using a telescope to check inside a woman, and it sees inside the abdomen with some magnification. So even if the endometriosis is small, whether it is just starting or it has formed a scar, in laparoscopy this can be seen and then biopsy. That means it can be excised and then taken for further testing to confirm that it is endometriosis. So once a woman suspects or have all this kind of pain, it's important that she presents in hospital and then further care can be administered to get answers. The effects of endometriosis also come from some of the predisposing factors of endometriosis. The actual cause of endometriosis is not known, but many theories or hypotheses have come to play. And for some of the factors that propose to this is endometrial lining found elsewhere. Sometimes, the uterus is open both into the abdomen and outside. So it can go back. The menstrual flow, instead of coming forward, can go back, and then some of these endometriosis cannot be exposed to the abdominal lining, that's the peritoneum of a woman, which can lead to her symptom. Some theories say that it's probably because some new cells that are generating might generate in that form. So the cause is not really known. But some of the things that predispose women to this are women that start menstruation early, women that start menstruation less than 12 years. That means they have more menses in their life. So therefore, making them more at risk. Women that don't give birth on time, like people that have infertility, this can be from endometriosis, because the endometriotic tissue secretes a lot of things that can affect conception. Also, it forms scar in the pelvic cavity. The organs in the pelvis are the uterus, the ovaries, the tubes. So endometriotic deposit on any of these structures can lead to scar formation and blockage of the tube, or even causing maybe hydrosalpinx, or causing cysts that contain toxic things that can be toxic to conception. So it has been found out that many people that even have infertility, some of the time, the bottom line cause is endometriosis. And after dealing with this, some of them actually go on to give birth. We're grateful for African culture where marriage and childbirth is a big thing, but this has started changing. So many women delay their first pregnancy, many women delay their childbearing. So we encourage that women should get married, give birth on time, as this might help prevent the endometriosis from happening, because during childbirth, estrogen is less. So there's nothing to feed the endometriotic tissue. Then women that have menstrual pain should seek care in the hospital, because many a times it might just be this cause that is causing the menstrual pain. And some people have menstrual pain that prevent them from even going to work or going to sell their wares in order to earn a living. Once some women are menstruating, that week is unproductive for them. So going to the hospital to seek care and proper advice on this can also help them get treatment for it and prevent further happening. Also, some women might not even have this pain or these symptoms, but it's just that they've been unable to have a child. So if they go to the hospital on time, at least after a year of getting married and not having a baby, to go to the hospital for investigations, this can be discovered, because some of the other investigations might come out correct. But a simple diagnostic laparoscopy and cystoscopy can just be the answer, because many people, it might just be a small endometriosis with big symptom and big endometriosis with small symptom. But anyone that is found out, it is becoming more available in Nigeria. Especially the specialist hospitals and many private hospitals have facilities for laparoscopic surgery in Nigeria, where this can be investigated and even treated.
Improving our health-seeking behavior as citizens is germane to wellness and living a good life. Here are some tips to motivate Nigerians to inquire more about their health status, with a view to attaining early detection and subsequent treatment and solution.
Tips for female reproductive health care. Practicing a healthy lifestyle with a good diet and exercise can keep the vagina and vulva in good shape. Walking and running can help tone up the pelvic floor. Make vaginal washing a part of your daily routine. Washing with water alone, a mild unscented or natural ingredients are recommended. Avoid using harsh-scented products. Contact your local healthcare provider if you notice any unusual changes in smell or color any symptoms such as burning or itching associated with vaginal discharge. Always seek medical advice if you think you are at risk of sexually transmitted infections or experience changes to the smell or color of your vaginal discharge. Get regular screening. Regular gynecological examinations, including pap tests, mammograms, and HPV tests, can help detect abnormalities early on and improve chances of successful treatment. Avoid smoking and drinking excessively. Both habits can negatively impact reproductive health and increase the risk of certain cancers. Know your family history. The knowledge of the reproductive health matters that runs in the family can help you and your healthcare provider make informed decisions about screening and prevention.
This is a call to action for our mothers and sisters to drop some notions which the society see as normal. This is where we draw the curtains on today's edition of the program. You can watch these as well as previous episodes of the program on our YouTube page displayed on your screen. My name is Yetunde Jayola. Bye for now.